Have you ever noticed that your body doesn't respond the way it once did? Maybe you feel less energy during the day, or perhaps it has become harder to maintain confidence at night. Stress, fatigue, and medical conditions like high blood pressure or diabetes may also begin to affect how you feel about yourself. If this sounds familiar, you're not alone. Research shows that performance challenges affect millions of men worldwide, and they become more common with age. But here's the important truth. These issues are not just about intimacy. They are often a window into your overall health, your circulation, your hormone balance, and even your emotional well-being. I'm Dr. Berman. In this video, I'll take you through the science behind these challenges, explain the common causes, and most importantly, share natural support strategies that can help you restore vitality, confidence, and a better quality of life. Now let's talk about the causes of performance challenges in men. It is important to understand that this issue is rarely caused by just one factor. Instead, it usually results from a combination of physical, hormonal, psychological, and even lifestyle influences. Let's break it down into four main categories. 1. Vascular and circulatory health. One of the most important causes is the health of your blood vessels. For a man to achieve and maintain performance, blood must flow freely into the tissues of the body. If the arteries are narrowed or stiffened, a process called atherosclerosis, then circulation is reduced. Atherosclerosis is strongly linked to conditions like high blood pressure, high cholesterol, diabetes, and smoking. Here's the key. The blood vessels involved in performance are much smaller than those in the heart. That means blockages often appear here years before they show up as heart disease. In fact, some researchers call performance challenges the canary in the coal mine for cardiovascular problems. So if you experience difficulties, it may not just be a personal issue. It may be your body's way of telling you that your heart and circulation need attention. 2. Hormonal balance. The second major factor is hormones. Testosterone is often called the male hormone, and it plays a critical role in energy, confidence, and overall vitality. As men age, testosterone levels naturally decline. This condition is sometimes called andropause, similar to menopause in women. Low testosterone can lead to reduced energy, lower mood, decreased muscle mass, and of course, reduced performance. But testosterone is not the only hormone involved. Thyroid hormones regulate metabolism and energy. Prolactin, when elevated, can interfere with male performance. Cortisol, the stress hormone, can suppress testosterone and disrupt the body's balance. That's why when a man presents with performance challenges, doctors may order blood tests to check not only testosterone but also thyroid and other hormonal levels. 3. Psychological and emotional factors. The third category is psychological. The mind and body are deeply connected, and emotional health directly affects physical function. Stress and anxiety can trigger a cycle. Worry leads to tension, which disrupts performance, which then increases worry. Depression often reduces energy, interest, and motivation. Relationship issues, lack of communication, unresolved conflict, or emotional distance can also manifest as physical difficulties. It's important to say this clearly. Performance challenges do not mean weakness, nor do they mean a man is less of a man. They are a signal that the body and mind are under strain. 4. Medications and other health conditions. The fourth category is medications and other medical conditions. Many commonly prescribed drugs can have side effects that impact performance. Blood pressure medications, certain antidepressants, prostate medications, even over-the-counter allergy drugs. In addition, conditions like obesity, sleep apnea, and chronic kidney disease can all contribute. That's why a thorough medical evaluation is essential. Doctors look at the whole picture, physical health, mental well-being, medications, and lifestyle to identify the true cause. So what's the most important thing to remember? Performance challenges are not random. They are often a sign of deeper issues in your blood vessels, your hormones, your emotional health, or the medications you take. The good news is this. Once the underlying causes are identified, there are effective strategies to support and restore performance. Performance challenges are not only a private issue, they ripple through nearly every part of daily life. Let's look at how. 1. Confidence and self-esteem. When men notice changes in their performance, confidence often takes a hit. Some begin to doubt themselves, wondering if they are losing vitality or masculinity. This self-doubt can spread into other areas of life: work, friendships, even motivation for hobbies. 2. Relationships and emotional connection. These challenges can also affect relationships. Many men avoid talking about the problem out of embarrassment, which can create distance between partners. A lack of communication may lead to misunderstandings. One partner might think the other has lost interest, when in reality it is a health issue. Studies show that when couples openly address these issues together, not only does intimacy improve, but emotional connection deepens as well. 3. Sleep and energy levels. Nighttime disturbances, whether from stress, frequent awakenings, or worry, reduce sleep quality. Poor sleep means less energy the next day, which worsens fatigue, concentration, and overall well-being. 4. Quality of life. Altogether, performance challenges can impact overall quality of life. It's not only about intimacy, it's about feeling energized, motivated, and connected. Many men report withdrawing socially or avoiding activities they once enjoyed because they feel less confident. Performance difficulties are not simply a bedroom problem. They are a whole life problem, touching confidence, relationships, sleep, and mental health. The good news is that once the underlying causes are addressed, not only does performance improve, but energy, self-esteem, and relationship satisfaction often rise as well. Now that we understand the causes and daily impact of performance challenges, let's talk about what you can do about them. Natural strategies that support your health, energy, and vitality. Remember, these are not quick fixes. They are long-term habits that build a stronger foundation for your body and mind. 1. Nutrition and diet. Food is fuel, and the right nutrition can significantly improve circulation, hormone balance, and energy levels. Fruits and vegetables. Rich in antioxidants that protect blood vessels. Tomatoes, for example, contain lycopene, which has been studied for its role in prostate and vascular health. Whole grains and fiber help regulate blood sugar and support heart health. Stable blood sugar means more stable energy. Healthy fats. Omega-3 fatty acids from salmon, mackerel, and walnuts reduce inflammation and improve circulation. Zinc and magnesium, found in pumpkin seeds, beans, and nuts, essential minerals for hormone function. Limit processed foods and sugary drinks. These increase inflammation and damage blood vessels over time. 2. Exercise and physical activity. Regular movement is one of the most powerful tools you have. Cardiovascular exercise, walking, cycling, or swimming improve blood flow, which is essential for performance. Aim for at least 150 minutes per week. Strength training, lifting weights, or bodyweight exercises maintain testosterone levels and muscle mass. Pelvic floor exercises, Kegels, strengthen the muscles that control urinary and sexual function. Flexibility and stress relief. Yoga or stretching routines enhance circulation and calm the nervous system. Exercise is not about extreme workouts, it's about consistency. Even 20-30 minutes daily can transform health. 3. Sleep and recovery. Good sleep is essential for hormone balance, energy, and mental clarity. Aim for 7 to 8 hours of quality sleep each night. Go to bed and wake up at the same time daily. Reduce screen use before bed. Blue light suppresses melatonin. Avoid heavy meals, alcohol, or caffeine late in the evening. Men who improve their sleep often report dramatic improvements in energy and performance within weeks. 4. Stress management. Stress is a silent enemy. Elevated cortisol not only lowers testosterone but also interferes with blood vessel function. Breathing exercises. Slow, deep breathing lowers stress hormones. Mindfulness or meditation. Just 10 minutes daily reduces anxiety. Hobbies and social connection. Maintaining joy in relationships improves emotional health. Nature exposure. Even a walk outside lowers stress levels and blood pressure. 5. Avoiding harmful habits. Quit smoking. Smoking damages blood vessels, reducing circulation to every organ. Limit alcohol. Excess alcohol disrupts sleep, hormones, and liver health. Check medications. If you suspect side effects, speak to your doctor about alternatives. 6. Supplements and natural aids. While not magic solutions, some supplements may provide support. L-arginine, an amino acid that supports blood flow. Panax ginseng, studied for its effect on energy and circulation. Zinc and vitamin D, essential for hormone production. Ashwagandha, may help reduce stress and improve vitality. Important, always consult your healthcare provider before starting supplements. Not all are safe for every person, especially if you take medications. Natural strategies are about creating a lifestyle that supports energy, circulation, and hormonal balance. Think of it this way. Every walk you take, every healthy meal, every good night's sleep, these are investments in your health and vitality. Over time, these small choices add up to big results. As we come to the conclusion of this video, let's take a moment to reflect on what we've learned. Performance challenges are not just about one aspect of life. They are a signal from your body, telling you about your circulation, your hormones, your emotional health, and even the effects of daily stress. The first step is understanding the causes: vascular health and blood flow, hormonal balance, psychological and emotional well-being, medications, and lifestyle factors. The second step is recognizing the impact these challenges can have, not just in private, but on your confidence, your relationships, your sleep, and your overall quality of life. And the third step, perhaps the most important, is taking action. Through nutrition, exercise, better sleep, stress management, and avoiding harmful habits, you can build a lifestyle that supports vitality. Natural strategies are not overnight fixes, but over weeks and months, they reshape how you feel and function. Here's something I want you to remember. Every small step counts. Choosing a healthier meal, taking a walk instead of sitting all evening, going to bed on time, or practicing 5 minutes of deep breathing. These choices may seem small, but together they add up to powerful change. I've seen patients who thought their energy was gone for good, who believed these challenges were just part of getting older. But once they made changes, they regained not only performance, but also confidence, joy, and connection with the people they love. So here is my message to you. Do not ignore the signs. Do not accept low energy or performance challenges as something you must live with. Take action today, and your future self will thank you. Thank you for watching. I'm Dr. Berman, and I hope this guide has given you both knowledge and encouragement. Stay healthy, stay confident, and never stop investing in yourself.